Joined by Barbara Peterson, high-risk oncology genetics nurse practitioner at Mercy's Helpline Cancer Center, to talk about a powerful new tool called Volpara that's changing the way breast cancer risk is assessed. Mercy is the first in Eastern Iowa to offer this. Barbara, thanks for being here today.
Thank you so much for having me.
And can you tell us how Volpara, what that is, and how it helps assess a woman's risk for breast cancer?
Well, Volpara is an integrative computer program that works with our electronic health record to very quickly assess whether or not women have an increased risk for breast cancer. It utilizes different pieces of information that mammograms do not, such as whether or not they took hormone replacement therapy, if they have dense breast tissue, or even if they have a family history.
This adds that extra layer. So when a woman comes in to get her regular mammogram screening, how is that software used in that process?
Well, at the time of the appointment, we'll send a link to them so they can go ahead and think about their family history and start downloading a lot of their information into the system before they even show up for the appointment. Then when they're there, this will be reviewed. And then once the mammogram is done, they have that the breast density that can be added to it, and then a score is calculated. If that score is greater than 20%, they now qualify for increased screening.
Okay, that's just more information that's helpful to know. And Mercy is the first in Eastern Iowa to offer this technology. What makes Volpara unique in breast cancer prevention and early detection?
Well, what's interesting is when they come to see us in primary care and other settings, we will have to ask a lot of different questions just to get a score on one tool. Volpara can take a lot of information, apply it to multiple tools to make sure that we're actually capturing all of the different information that we need. That information in such a timely way helps people to know immediately by the end of their appointment really whether or not they qualify for high-risk screening.
That is helpful. And how can knowing your breast cancer risk change the way patients approach their health care?
Absolutely. Well, if they do score above 20% for that lifetime risk for breast cancer, they now can qualify for breast MRIs and other interventions. They can be seen in oncology by a breast specialist. They can also know what their risks are so they can talk to family members about it as well because they may share the same risks.
Siblings, things like that, yeah. And where can women go for more information?
They can go onto Mercy's website. Just follow the links. It is mercycare.org/risk assessment. And if they have any questions, of course, they can call the operator and they'll be directed straight to us.
All right, Barbara, thanks for being here today.
Thank you.
And stay with TV9. We'll be right back.